Today we're going to demonstrate our technique for superior labral repairs, also known as slap repairs of the shoulder. This patient was younger, continued slap pain, failed cortisone injection and physical therapy. You can see here there's increased mobility of the complex. The biceps was pristine, and this had extension to roughly the 10 o'clock position without any inferior or posterior inferior progression. We do a exam under anesthesia, visualizing the biceps to confirm there's no subluxation of the biceps itself. Following this, we use a shaver / bone cutter to debride the glenoid in preparation for the repair, and further to slightly debulk the labrum itself. This will also aid in passing. Initial debridement followed by the bone cutting portion to access the subcondylar bone for healing. Following completion of the shaver, we use a rasp to further aggravate the area to improve healing potential of the superior labrum. We repeat a shaver here to remove any of the loose fragments. Intention is turned towards the third portal. Here we have a percutaneous transtendinous portal. We make sure we can access both of the potential anchors we'll use. This is an inside-out technique. A small knife is placed through this needle to allow us to access through the portion of the cuff. Following this, we use a 17 gauge needle, 9/0 wire, and a dilator with our metal cannula. In this case, we're going to use knotless fiber tacks, so we use a switching stick to upgrade to a 5.75 cannula, which makes this slightly easier. Again, sequential dilation is performed to reduce any further damage, but also to allow for ease of placement of these cannulas. We again check with the cannula to make sure we can access both portions of the repair. Again, this is going to likely be a 2 anchor repair. Here we're placing the first knotless fiber tack. We use a Linvatec passer to pass through this portion of the labrum. A PDS suture is used for shuttling. This is brought through the superior portal to avoid tangling. It is tied and a pass of the stitch is used. Following this, we shuttle the repair stitch through the labrum. To avoid tangling or any issue with the knotless function, we remove this area right here. Following this, we pull the repair stitch back through that superior stitch, as we want to engage knotless function directly in line with the anchor. Here we've engaged it already, and we're sequentially tightening. The nice thing about these anchors is you can do a moderate or a tight repair as needed, and it's knotless. Here we use the flat cutter as a final tightening device, as well as to cut the suture itself. We'll now place a second anchor closer to the biceps itself. Once this is impacted, we'll do a similar process with the Linvatec passer. So again, from the anterior cannula, we use a 90-degree lasso through the labrum itself. PDS suture for passing, use the superior portal to shuttle this suture. The stay suture is shuttled through. We then take the stay suture, once it's shuttled through, up through the superior cannula again, and again we will re-engage the locking mechanism of this fiber tack. Continue to cinch this knotless fiber tack down. Here you can adjust the amount of tension you want. In this situation, we wanted maximum compression. We use the cutter as a final tensioner and then to cut the fiber tack flush. Here you can see here we've secured the entire posterior slap tear. There's no further extension posteriorly. There is a standard sublabral foramen which we did not fix